It is time now for our Vidant Health Spotlight, and Vidant Medical Center has just been awarded the advanced certification for comprehensive stroke centers in the country. That was just announced, and it has earned the Joint Commission's Gold Seal of Approval and the American Heart Association, American Stroke Association's Heart Check mark for advanced certification for comprehensive stroke centers. These are symbols of quality from their respective organizations. Basically, it means you don't want to have a stroke, but if you do, Vidant Health can take good care of you. Here to talk about that is the stroke center manager for Vidant Medical Center here in Greenville, Ashley Elks. Good morning, Ashley.
Good morning. How are you?
Congratulations on this big certification. That's pretty big news, isn't it?
Thank you. It is very big news. We are incredibly excited.
Now, Vidant Medical Center's recent Joint Commission designation as a comprehensive stroke center, did it come as a surprise, or was it something you were working toward? Tell us about how this happened?
Absolutely, yeah. So we've been a primary stroke center since 2007, and have been on this journey to a comprehensive stroke center designation, which is the highest designation you can get, you can receive from the Joint Commission. And so it has absolutely been a journey. We've been working really hard to build a great neuroscience team, a strong infrastructure, a system of care in the region to support this designation. So no, we weren't surprised because we've been providing this high quality care for a while. It has just been great to have an outside organization who travels all over the country, looking at organizations and evaluating them for high quality care. So to be designated as, there's less than 175 in the country. So to join them, it really is an honor to be among an elite group of comprehensive stroke centers.
I was actually getting ready to ask you how many hospitals got this designation. So only 175 in the entire country.
Yep, I believe we were 174. I know it's less than 175, and there's less than 10 in North Carolina. And we are the only comprehensive stroke center east of Durham and Chapel Hill. So a very, very, very big news story for the region and the citizens of Eastern North Carolina.
Yeah, what does this mean for us, the folks who are your patients, your customers here in the Vidant region?
Yeah, so I think there's, two parts of it. Here at Vidant Medical Center, that is a one-stop shop for everything stroke. So it's great because we have these close partnerships with our EMS agencies, and we can deliver the acute stroke care, the administration of Alteplase, which is the clot buster for stroke, as well as surgical options. And we also have the only neuroscience ICU in Eastern North Carolina and a stroke-certified rehab center as well. But I think even on a larger scale than that, as the comprehensive stroke center, we partner very closely with all of the hospitals in Eastern North Carolina, both Vidant Health community hospitals and then hospitals that aren't associated with Vidant, like Onslow Memorial, UNC Lenoir, Carteret, Carolina East. So we have a very close partnership with them, and so we're setting up this system of care. So no matter where a patient experiences a stroke in Eastern North Carolina, we're partnering with those hospitals to build their own stroke program so they can deliver that acute care as fast as possible and get patients that need to be transferred to a comprehensive stroke center for complex care rapidly transferred and treated at our facility.
We're talking to Ashley Elks, the stroke center manager for Vidant Health. And I remember years ago, we used to refer to Eastern North Carolina as the stroke belt. Mm-hmm. We have a very high incidence of heart disease and stroke in this area. I remember years ago when there was an effort underway to build a stroke center here. Mm-hmm. And people were talking about the need for it. But now it's not just here in Greenville at Vidant. You actually have a network of care throughout the system, right?
Right, absolutely. At the same time we were building the work that was happening at Vidant Medical Center kind of as the hub or the mothership for stroke care in Eastern North Carolina, it's also important that we grow those programs in all the regional hospitals well. The challenge of rural Eastern North Carolina, you don't get anywhere quickly, right? I mean, we have a lot of geographical challenges. Mm-hmm. So in order to make a true difference in the mortality and morbidity of stroke and to make a dent in living in the stroke buckle, it is about making sure that everybody, no matter where you are in the region, you have quick access to fast and effective stroke care, which is why we've worked so hard to partner across the region with EMS agencies and with the hospitals. So no matter where you are, where you live, we can get you treated quickly.
Let me ask for people who are listening that don't know the symptoms and the signs of stroke. At what point, what are the things that you look for, and at what point do you call for help?
Yes, great question. So it used to be kind of the acronym for stroke was FAST, and it's actually changed in the past couple years to B FAST. So B stands for balance. If someone all of a sudden starts having coordination issues, they stand up to walk and they're leaning to one side, that can be a sign that someone's having a stroke. E is for eyes, so sudden change in your vision. You can't see out of one eye, your peripheral vision's off. FAST is for facial droop. That's when somebody smiles and one side drifts down, or maybe someone's eating and you see kind of water or food come out of their mouth. A is for arms, so if you have somebody hold their arms up, maybe one can't stay up as long as the other, or they can't lift it at all. S is for speech, so slurred speech, maybe somebody is talking but they're not making sense, their word usage is inappropriate. And T is for time, and so as soon as you recognize stroke symptoms, that is when you need to call 911. It is a very time-sensitive disease, and we have a limited window in which we can treat you. That's recently expanded, which is a great thing. We have surgical options up to 24 hours to treat ischemic stroke, but nonetheless, the sooner you get to the hospital, just like if you were having a heart attack, the more likely that we're going to be able to do interventions that are going to produce a better outcome in months to come.
Can we do anything to prevent a stroke? Is it about lifestyle changes? What can we do to not be a stroke candidate?
Right. So there are factors that we do have control over and factors that we don't. The things that we do have control over: hypertension, definitely the high blood pressure, a healthy diet, exercise. I just really emphasize with people the importance of having a primary care physician, and that you're getting checked out regularly, that we're checking your cholesterol levels. So those are the things that you definitely have control over. And then, some of the things that we don't, our race, our age, those are things that we can't really influence. So the stuff that you can control, you really need to stay focused on. It's kind of the same tips you would do to prevent heart disease.
Yeah.
So.
All right. So those are great tips for the prevention and detection of stroke. And we hope you do not have one. But if you do, the great news is that Vidant Medical Center, and is it the whole system? Is Vidant Medical Center awarded?
Vidant Medical Center is a comprehensive stroke center, but the other great news is that our Vidant community hospitals, several have also been recently designated as primary stroke centers and acute stroke ready hospitals. So it is a system initiative.
So Vidant Medical Center has received the highest honor from the Joint Commission's Gold Seal of Approval and the American Heart Association's Heart Check. And they call it the advanced certification for comprehensive stroke centers. And so now Vidant Medical Center has this designation. Is this the first time, by the way?
Yes.
First time. So
very excited.
Well, you must be doing a good job.
I mean, I try. It's a privilege. I love working at the hospital. I love taking care of Eastern North Carolina. I was born and raised here, so these are my people. So it's nice to be a part of something.
I'm going to call Brian Floyd today and tell him to give you a raise.
Oh, okay, yeah. Do
you think
that.
you like that idea?
Yeah. Go ahead.
Brian just drove off the car into the ditch.
Yeah, don't commit him to that.
You're obviously doing a great job. So thanks for all that you do.
No, thank you.
And thanks for coming in this morning.
Sure.
I'm very proud of you.
Thank you.
And thanks to Erica Mizell, who set this interview up, who is out in the lobby with your new 2-year-old child. How do you do it all?
2-month-old.
2-month-old child. Excuse me. I meant to say 2 months.
Yeah. It's not work when you do what you love, so it's great.
Good for you.
Thank you.
Ashley. Ashley Elks, the Stroke Center Manager for Vidant.